I hope you stretched afterwards and that you
Yes,
drank
yes.
plenty of
Oh,
water.
definitely. I was that weirdo in the middle of the gym, just kind of like lying on the floor afterwards, everybody staring.
That's not being weird.
But
And
yeah,
don't get a massage.
I should.
Seriously.
I'm kind of afraid anybody touching me right now, to be honest, on the leg.
But it's good hurt. It's good hurt.
Yes,
So
very much so.
Hello everyone, my name is Dr. Dylan Collier. I'm a physical therapist and welcome to the New Medical Nomads podcast, where I get to document my journey as a medical traveler, as well as interview other experts within the traveling field. Now, the rules for the traveling game are constantly changing, so anything you hear on this show should be for entertainment purposes only. This is not legal, financial, or medical advice. Enjoy the show and safe travels.
Hello, everyone, and welcome to another episode of the New Medical Nomads podcast. Today, I am with Carissa Weller. She's a surgical tech. And Carissa, where are you at in the world right now?
So right now I'm in a southwest suburb of Chicago, specifically Tinley Park, Illinois.
Okay. Can you tell us a little bit? So I'll be just straightforward. I don't really know all that much about surgical technicians. So could you tell us a little bit about the career and then also how it fits into travel?
Sure. Well, it's, for me, in my personal opinion, it's perfect for traveling because we are part of allied health. And when it comes to the career, usually I say that we're a surgeon's assistant, not to be confused in any way with a physician assistant. But basically what we do is, which for one thing, I do love my job. I love what the career path that I've chosen, and it certainly allowed me to travel. But anyway, and I'm a Taurus and very OCD, so this job fits in perfectly with my quirks, I guess. But anyway, we basically set up the OR or operating room. So we get, once we know what room we're assigned to, we get our furniture, as I like to say, ready in the operating room, because not every case or specialty or service rather is going to need the same type of furniture in the operating room during the case. And so we get that situated, we get our lights or spots where we need them, and then based on what the case is, we will get our case cards and open or just have available all of the instruments that we'll need. And I like to say during the case, because usually I'm working in teaching hospitals, I always say that I'm the sterile police or aseptic police, because that's my job, you know. And then when you have, because I'm assisting the surgeon, I'm getting the field ready, I'm assisting the surgeon during the procedures. We need to anticipate, you know, what we need to know our stuff, so to speak. Like, we need to know what the procedure is so that we can anticipate, know the medical history of the patient. So this way we kind of know, all right, keep in the back of my mind, what am I looking for? Is this a diabetic? How sick are they really? Is this cancer? Because then that's a very different setup. We would need to have a clean versus a contaminated. Granted, everything is clean. You start with aseptic technique. But of course, if you're downtown, as I say it, or the genitals, which is what I call downtown, versus uptown, where everything always stays sterile, then, you know, you need to keep that in mind. Like, you need to have two different setups. And then if you're dealing with cancer, then you need to keep in mind, or colorectal surgery, you need to keep in mind that you need to keep all of that separate, because you don't want to spread the cancer or spread what's contaminated while you continue doing the remaining part of the procedure. And then we break down all the instruments and send it off to decontamination rather, or SPD.
Okay.
So I know it's the long version.
No, that's great. That was very thorough. How long have you been a surgical assistant, and how long of that have you been traveling?
So I have been a scrub or CST since 2008. So it'll be 9 years, February of 2018. And I've been traveling after spending my first winter here in Chicago. I've lived in a lot of places. So I've been traveling since December of 2015. So 2014 was my first winter here. And then that's when I decided, after being an employee for a year and a half, I was like, I need out. Because it was too much. The winters here are very different than anywhere else I've lived. It's a bone chilling cold.
Yes.
And I've always begged, I need to just make one, invent one. I want a down onesie so I could just step into it and zip up and I'm ready to go. So, so yeah.
Yeah, we had when I was a student, there's a physical therapist conference up north in that area. And that's when I first experienced that like bone chill that you're talking about. You'd be walking, especially between the buildings, and there's this gust that goes through, and oh my gosh, it's painful.
It's the lake effect. It's completely different. And I'm from New York. I'm from Manhattan. But again, like I said before, I've lived in a lot of places, but it's very different when you're anywhere near Lake Michigan.
Got it.
So yeah.
Got it.
But it's still it is beautiful, but I can do without the humidity, especially with all of this.
So is there any downtime for your profession between coming out of school? Like, do you have to wait a little bit before you can go right into traveling, or is it up to the practitioner to decide when they can start?
So that's actually a great question. It's suggested because you need to know all the services, so to speak, and there's a lot of instruments. And then depending on facility to next facility, even if it's within the same city or state, the names for things differ. There's a minimum of 5 names for everything. But anyway, it's usually suggested that you have at least 2 years that you've been scrubbing for a facility before, I would say, and again, this is my opinion, but before I would be very comfortable in just going out there and being like, okay, I can come right in and do this case, like read what's on the board and say, okay, I'm ready. I know what to anticipate. I know what to expect. And yes, I'm able to do this. Because then also there are a lot of people, because there's some, so when it comes to traveling specifically, for example, at the facility where I am right now in Indianapolis, well, not literally right now, but where I'm driving to this evening, they specialize in cancer and general surgery, but it's not like lap choles or lap appies. You know, it's not very small cases. These are very big cases where we're doing staging because we already know that this patient has cancer. And so you're going to have like a multiple table set up. You know, it's not just like a 5-foot long table that you've got instruments filled with. You really need to know, you know, what you're doing. For sure, general surgery, everybody always says, oh, a monkey can do general surgery. No, not really. But they're not trauma. They don't, you know, we're dealing with cancer. So there are a lot of, to go back, there are a lot of scrub techs, for example, that are like, they say, oh yeah, I'm a CVOR, which is cardiovascular OR tech or scrub tech. But they're expected to know, okay, so show me what you got, you know, show me that you know how to scrub and set up for a heart, whether it's a AAA, or if, you know, you're just going in to do like put in stents for a vascular case. Like they expect for you to prove yourself, so to speak. And so that's why I say a minimum of 2 years.
Gotcha.
And that's if you're like in a trauma hospital. If you're at a surgery center, no. The cases, you know, that patient's going home, their BMI has to be only so high in order for them to even leave or even to have the procedure done. But if you're at a trauma hospital, and again, that differs. Like I did this past winter was my first level 1 trauma in Chicago, and that's very different than Tulsa, for example, Tulsa, Oklahoma, because, you know, I'm dealing with gunshots and stab wounds, and it was really based on what the weather was here.
Got it. While
in Tulsa, they're big tractor accidents, or, you know, somebody who shot himself because he was showing off his weapon or his gun. Sorry, I'm ex-military. So showing off his gun, you know, to his friends, or he was in a huge car accident. So it's very different what you're dealing with. So if you want to be prepared, then definitely, again, my opinion, at least 4 years based on where you're working. But if you're just 2 years scrubbing, then sure, you should be able to handle the basics, I guess.
Okay. How did you begin or get into your travel career? So you said you had some military experience. Can you kind of go through that? And have you always been just, you know, this wanderer that needed to get out and see everything, or
So
Tell.
I'll answer your last question first. I definitely will say that I was born with the wanderlust. I've
Okay.
been traveling with my parents since I was an infant. Um, and yeah, I'm old enough to remember when you could go on with all kinds of crazy things on the plane, and all you did was draw a curtain so you could smoke in the back area,
Oh,
which
wow.
we were always in because my father smoked. um, doesn't anymore, not since he was diagnosed with his cancer. So
Okay.
he's definitely a cancer survivor. But anyway, I got into traveling again. I moved here end of May 2014 from Colorado, which I loved. But stuff happened there. But anyway, I came here because I have a relative that lives here. And I thought, why not? You know, I'm from New York. I can go ahead and try another city, major city. But still, New York's still bigger. Well, much more overpopulated rather, because
Okay.
by land they're not larger.
Got
Anyway, and I had my first winter experience here, and I said enough is enough.
it.
I need to be a traveler because I no longer wish to spend winters here in Chicago. But I'm glad that I did move. I mean, I'd always had traveling in my mind.
Mhm.
Actually, soon after I graduated from school, I moved to Austin, Texas. And I started talking to someone there about traveling. But again, I didn't feel like I was experienced enough because I had gone from a level 2 hospital to then in Austin, I was at a surgery center. And so I felt like I wasn't ready.
Mm.
And I always want to be ready for that surgeon. God forbid the surgeon should ever have to wait on me because
Mm.
I can't stand that. You know, I don't like, I need to be prepared in my opinion.
Okay.
And so that's why as soon as I go into a room, I ask if whoever's in there first, usually it's anesthesia. I ask them, okay, so what do you know about the patient? Have you seen the patient? What are their allergies? You know, because I start thinking in my mind, what do I need to do? What do I need to get prepared for? What should I expect? So, but that's what got me into traveling. And then it's nice being able to get paid to be in new cities. So,
Right.
yeah.
How was so you were? What did your parents do growing up that you were traveling all the time? And then how was that kind of bouncing around as a child?
So, they weren't military. My mother eventually became an HR director in New York. And so we were there that whole time. But to back up a little bit, my grandfather taught at NYU and as well as Puerto Rico University. So my mother, when it came to her childhood before she went off to college, she spent, I'd like to say, half of that life in Puerto Rico, or PR as we call it, and New York. And so she was always going back and forth depending on where he was teaching at the time.
Mhm.
And my father, I don't know if you've ever heard of off-track betting or OTB.
I have not.
Okay, so he was one of, and I was surprised to see them here because I thought they were only in New York and New Jersey. But anyway, he always managed, or I don't know exactly what the term is. Anyway, he was the boss there. But I always thought when I was young, because he always had these beautiful custom made suits, I always thought that he was part of the mafia when I was young. I know that's stupid and very idiotic, but he always, he had the gold rings and everything. And I really thought that he was part of the mafia, but no, he wasn't. He worked for OTB. But so anyway, it was just always vacationing. So it was never for work that we were traveling. It was just taking vacations.
Okay.
And
Got it.
but I still have traveled much more than both of them combined. So
Wow.
my mom always says that now that I'm a traveler CST, she always claims that she lives through me. So
All right. Do they come and visit you on your trips?
no, they haven't. I'm actually the one that I'm trying to get with a November 6th start. I'm trying. So I have, my parents are divorced. And so I do have two sets of parents in two different states and country. But anyway, they're both snowbirds. Both my New York parents and my Texas parents. They also have, the New York parents have a home in Florida, and so they of course go there in winter. And then the Texas parents have a home in Costa Rica. The poor thing. And so they go there in winter, even though Texas doesn't really get a bad winter. But anyway, that's their decision. But no, I'm trying to get either in Washington State, Seattle specifically, because I did spend 14 years there as an adult, and then if not, then Texas. So this way I can be near my grandmother, who has been living with that set of parents for a few years now, because she's got a form of dementia. So yeah, I want to be able to see her as much as possible.
Absolutely.
But no, they've never visited me, because up until, well, my very first, I've only done 4 contracts, by the way. I only do 2 a year. And it's not that I'm bragging, it's just thankfully my boyfriend, I've never been interested in having a house or a mortgage, exactly, to be specific. I was fine just renting, so this way when something is damaged, I can call that landlord up and say, okay, this is what I need fixed. But once we met, he just chose to get a smaller house with a much larger backyard. And so I just pay a few bills here and there, and then of course my own lifestyle, I guess you could say. But yeah, so I'm thankfully, because of that, I'm able to do 2 contracts a year, and then we travel or work on the house.
Very cool.
When I'm off. So
yeah. How long are your contracts typically?
So I've only done 13-week contracts. The beauty of being a traveler, in my opinion, when you just start to get sick enough of somewhere, then you can, your contract's over. And I did extend one, so we adopted a 2-month-old puppy to add to our family. And I chose this was last November. And so I chose to take a local contract. So this way I could be here for the training. And that's when I ended up working at Mount Sinai, Chicago, level 1 trauma, which again was a great experience. But my first one was in Tulsa. And I went with my dog. I've always traveled with my dog. That's the older one. She just turned 9 in July. And so that at first was difficult. I didn't think it was going to be that difficult, because I've had long distance relationships before. But so it was great when, you go from like living together and being around each other all the time, especially when you're not working full time. And then it's like now you're only seeing each other every other weekend. So thankfully he's salary, and so his job allowed for him to come in, fly in on a Friday when I'm getting off of work, and then he'd fly back out after I was at work or had to be at work on a Monday morning. So it was, you kind of felt like you were living a normal life then. But then my next one, the next contract that I took was in Mount Vernon, Illinois. So it was actually faster for me to get from our door to St. Louis, to Cardinal Nation, than it was for me to get from Mount Vernon, Illinois, to our door here in Tinley Park. So yeah. And then after that was Mount Sinai, and then now Indianapolis, which is, if there isn't construction or a big, huge accident on I-65, it's about 2.5 to 3 hours drive. So
yeah, I'm familiar with the Mount Vernon area just from taking road trips towards Chicago. Yeah.
Are you a Cardinals fan, by the way?
Oh, yes.
You can't talk any longer now. Okay. All right, good.
What is something that you wish you would have known when you were starting out this travel career?
Okay, so I wish I would have known that it is okay to have, and it's very normal practice, to have more than one agency. Because when I was very naive about it, and I believed what people told me. And so my first agency, which I'll keep them unnamed. But anyway, because everybody's entitled to their own thoughts. But I trusted a lot in her, in my recruiter. And I would ask these questions very innocently, because I was expecting to get a real answer or just the truth. And she very quickly said, oh no, that's not very kosher. You can't have more than one recruiter. I mean, that's just very wrong. Therefore, you shouldn't have more than one agency. And in my first facility that I went to there in Tulsa, which, by the way, I was very grateful that they were my first experience when it came to traveling, because for one thing, they had 32 ORs, which I loved. And I was hired to do neuro, which I love doing neurosurgery and spine. And majority, I thought these people were all employees, and majority of them were travelers. And
Oh
so
wow.
that's how I heard about TravCon. That's how I met Laura with Nomadic Hair. Now empowered nurses and allied health travelers. Or therapists, actually, is what her other website is. And so I just wish I would have known that it's more than fine to go ahead and have more than one car dealership to go to, which isn't the most positive spin on them, but unfortunately, everybody, they need to make their money as well. And I get that they make commission, and there are some that are really great. But every single one of my contracts has been with a different agency. And I love the ones that got me, Total Meds, that got me into Mount Sinai, Chicago. But she just wasn't able, my start date for my next one was June 5th, and she wasn't able to get me anything. And so that's the only reason why I went with a completely different company.
Okay.
But, unfortunately, you don't know about them until you either connect with Laura and ask them, the people, or ask her, everybody that she's actually interviewed through her strict interview process, or you experience, positives and negatives with them. And I have to say, though, I haven't really cared for my recruiter with this current agency, but I've loved the facility. I mean, it's been great, the experience.
Great. That's awesome.
How was your birthday, by the way? I saw you.
Great. Thank you so much. Yeah.
Did you end up reaching 100?
Do what?
Did you end up reaching 100?
Oh yeah. Yep. Absolutely.
Okay.
Yep. Right. I think next year is going to be a little more challenging, but I'm still sore today. That was like 3 days ago. I'm still getting out of bed. Like, oh my gosh.
Well, of course, I hope you stretched afterwards.
Yes.
And that you drank plenty of water.
Definitely. I was that weirdo in the middle of the gym, just kind of like lying on the floor afterwards. Everybody's staring.
That's not being weird.
But yeah.
And don't get a massage.
I should.
Seriously.
I'm kind of afraid anybody touching me right now, to be honest, on the leg.
But it's good hurt. It's good hurt.
Yes, very much so. You were kind of talking about your lifestyle earlier and how you take, multiple vacations. Is it multiple vacations in a year?
Yes.
Yes.
So I always, even when because one of my questions, even when I've applied to be an employee, I always ask them what their policy is regarding taking unpaid vacation, because I'm serious about, I work so that I could travel, and everybody, of course, has different, different drive when it comes to things that they want in their life. But like, have you ever seen that show Tiny House Nation? Or so I'm all about that. Like, I'm not interested in having a bunch of crap, or just a bunch of stuff. I want for things to make sense. I don't know if you can see behind me, but I'm obsessed with elephants. And so if I have to have something, everything here when it comes, and I'm all about interior decorating. When it comes to doing that, it's like, I just want it to be basic, simple, and things that I love, because I don't just want to have a bunch of stuff. And I've moved so much that thankfully, that has allowed me to just take notice and be aware of what inspires me, what is meaningful to me, besides my dogs, of course, because I almost act as though I birthed them. And I've never been interested in actually having children that walk upright. I only want the dogs, the ones that are, exactly. I'm all about fur babies. And that for me is fine. Like, I'd be fine. I'm actually in the process of trying to buy an RV. But I want like an eco-friendly, again, I spent 14 years in Seattle, so I'm all about, the green movement and being as eco-friendly as possible. And so it's just, we can live happily, very minimalistic, and so that I try to do that. Don't get me wrong. I do love shopping, but I do try to purchase items online. And then again, within that 100-mile thing. So this way they're not using, too much gas, but yet I don't have a problem with getting on a plane, which is using plenty of, or actually, which is damaging our atmosphere. But again, it's like, we only have this one life, and so I want to experience as much as possible about it. But yeah, it's just, I want to experience and get out of this life as much as I possibly can. yeah, and if I have to claim a religion, I do say Zen Buddhism. So this way, hopefully I'll come back as something else, something maybe a fear that I haven't, I don't know, taken care of in this lifetime. But I'm sure I was a pilot in a past life. I hope I was. Way back. I mean, I've always been interested in medicine. I did start off pre-med back in the day. But boyfriends happened, and and then I joined the military. But I did not do medical in the military. I was actually a computer programmer, which is frustrating because it's not user error, in my opinion. But yeah, that's a whole nother story. But I want to try and experience as much as possible. And that's another reason why I feel that being a CST or a surgical technologist is great for me, because I'm always learning. I hope to always be learning every single day that I show up for work. And I'm there for the patient. Like, the very first thing for me is I'm there for the patient. I treat every single patient as though it's a family member and how I want to be treated. So
got it.
The younger, I feel like there's some, and not all, but the younger generation, I know that you fall into that category. Not everyone has a great bedside manner. It's like there's some things that, like, sure, there's book stuff, but bedside manner, you need to be taught, and it's kind of like respect, it's just, and I'm not saying that the younger generation don't have that, but it's so like tech savvy and moving forward that people forget about the one-on-one with someone and making connections with everyone, which is very important as a traveler as well. Like, you need to make connections with people and get to know, everybody has a story, and so it's like, talk to people and get to know them and remember something about them, because you can always connect to that. There's just, everybody is somebody's family member.
Absolutely. It kind of goes into that. So you have your IQ, which is your intelligence quotient, but you also have your EQ, so your emotional quotient.
Exactly.
And being able to connect with others. And for a long time, I know that was thought to be like an unlearned trait, but you can actually learn that. And I believe there are even organizations out there that try and teach other people. The one example that comes to mind, it was a genius. So he did the IQ test and scored over whatever the limit is, and he's a certified genius. And he was blessed enough to have like an EQ that matched his IQ. So he was like,
that's amazing.
But he started a company that would recruit all these other geniuses or genii that didn't have that EQ, and so he would be able to teach them that, or kind of take that side of it when they were working on partnerships or businesses and things like that. And so that was a really interesting story to listen to.
That's wild. Was that in a book, or was that on a?
I think that was on a podcast. I'll have to see if I can find it and then put it in the show notes. I'm pretty sure it's on Tim Ferriss's podcast.
Okay.
But when you're talking about unpaid travel leave from contracts, how does that work? So if, say, you needed a week off, you're going to go somewhere, or maybe there's a conference you wanted to go to. You take a week off in the middle of that 13 weeks. Does it just extend? Does the 13 weeks you work for them now become 12, or does it just kind of extend another week, where it's 14 weeks total, but you're still only doing 13 weeks with them?
So another excellent question. So in the past, after my first one, I didn't know that you could, like, I just didn't understand traveling and everything that you could ask for in your contract, and just how important it is to make sure that everything you discuss needs to be in your contract, which Laura definitely pushes. Simply because if it's not in the contract, it doesn't exist. If it's not in writing, it does not exist. So once I learned after that first contract, I then knew, okay, I need to ask off for especially if you're on call. So once you know exactly, once you have your phone interview, which was really weird to me, because I'm used to going through at least a minimum of 3-step interview process, where once you pass the computer test to see if you're emotionally capable of doing this job, or if you're going to be a leader versus a follower, type thing. Then you have your phone interview to see if you're worthy of going in and meeting with HR. And then after that, it's usually a peer interview type thing, which I think is great. But when it comes to traveler, it's maybe a 5-minute phone call. If you ask questions. If you don't ask questions, then they just basically tell you what's up. And then if you need to have certain days off, you need to be, or again, I feel like you should bring that up. Like you should bring everything up because they're trying, hopefully, if they're a good interviewer, then they should try to get like the gist of you in those so many minutes, or get to see what you're about, or what you specialize in, or what service you're best in, and how, like, because just because you have something like 25 years experience scrubbing doesn't mean that you're a great CST or a great ST. And then I personally feel the more well-rounded you are, so the more different types of facilities that you've worked in, then the better you're going to do as a traveler. But basically for me with this last one, I need to have a period of 10 days off, which included weekends. That was 2 weekends, and then of course the work week, the 5-day work week. But I don't have to take call on this contract. So I just needed to make sure that my days off, because I work 4/10s, and I'm used to coming in and giving lunches, and then I don't give. So usually I start midday. I'm not a morning person, and I'm fully aware of that. So having to be somewhere and actually function at 6:30 in the morning isn't okay, or it's not the best. It's not my ideal. But anyway, and so with this one, it's 4/10s. I start at 6:30 on average. But I needed to make sure that because I was doing Airbnb, because I do have a house here in the suburbs of Chicago, and I'm working in Indianapolis, I needed to make sure that the moment I got off work, because call isn't required, that I leave. I'm not going to be delayed in leaving because I do have a 3-hour drive ahead of me. And I put in my request for vacation, and they told me, oddly enough, they told me during that phone interview, they said, well, no, you're not, travelers aren't required to take call. And even though you need time off, we're not going to extend or you don't need to extend your contract. And I said, are you sure? Because in the past, any day that you asked off, they expected that to be tacked on to if it was during the week, they expected that to be tacked on to your end date.
Got it.
Yeah. And I've only extended once, and that was with Chicago, with Mount Sinai. And I just did a 3-week extension.
Okay.
So, but I went from 4/10 to 8, because I just had other stuff going on at home, but they were fine with that. So.
Okay. Got it. That was very helpful. Thank you.
Hey guys, so thank you so much for joining and listening to part 1 with Carissa. Part 2 will be launching in the upcoming week, but if you can't wait and you want to hear part 2 now, you can go ahead and go to the YouTube channel where you can find all the episodes there. And that episode, the next one, part 2, will already be up. So while you're there, if you could please like, comment, and subscribe, that's going to help me get my message out to other travelers and other soon-to-be travelers who are in the medical field. If you are on Facebook finding us, any other platform, iTunes, please just go ahead and rank us, give us a like, show us some love. I would really appreciate it. And you guys, of course, have safe travels.